everybody, and welcome to the Dr. Mom Show. It's Dr. D, mom of three. Thanks for joining me this week. I can't wait to get into our topic of the day because it's definitely seasonal, since now hopefully the weather will be getting nicer shortly. I hope everybody is staying safe as we are still on a social isolation, or social distancing I should say, and isolation, washing your hands well and doing well with your kids. Don't forget, at the end of the show, I will continue to give my COVID-19 tips on how to survive during this time and hashtag conquer COVID. Before we get into the show for today, I just want to remind you that the Dr. Mom Show is a medical informational program that does not take the place of your physician or your child's physician. Please, if you need medical attention, seek that through your provider or your child's provider for their medical advice. So don't forget to check out DeleenMuchalak.com. I have a new book collaboration coming out called Women of War, Peace in the Midst of the Storm. It's a wonderful collaboration of 14 women who tell their stories and tell their battles and how they overcame and won. And it's a great encouragement tool. It would definitely inspire you and empower you. Don't forget, Mother's Day is coming up, so you can pre-order your copy. That will be coming in June of this year. Also, don't forget to order your copy of The Tripsies and Me, my international bestseller. Right now, also, my mom devotional is on back order. So those aren't available right now, but you can always order it and we'll ship it out to you as soon as possible. All right, well, let's delve right into this. So today we will be talking about coughing, sneezing, watery eyes. Oh my. So we are talking about allergies. So what are allergies? So if you do have allergies, you're probably like, oh, I totally know what allergies are. But there are different types of allergies. There's food allergies, environmental allergies, medication allergies, so tons of allergies. Today, more specifically, I'll be talking mostly about seasonal allergies, also what we call allergic rhinitis, and allergies to things like grass, pollen, mold, so environmental allergies. So really, allergies as far as seasonal and environmental are separated into two types. So of course, seasonal allergies, which occur at specific times of the year. The most common times are during transition of season, so from spring to summer, and then from fall to winter. And then of course, there's also perennial allergies, which are allergies that can occur all year round. And those include things that are more constant, so they aren't seasonal. So things like grass, mold, cockroaches, stuff that can be around animal dander. So those are perennial allergies. So if you have allergies, what kind of symptoms do we usually see? So normally patients with allergies will have a clear runny nose, and that's key. That nasal discharge is clear. It's not like thick yellow green. It's not that congestion that you see with sinus infections. It's a clear, watery nose. A lot of times it's just dripping. It doesn't stop. You're constantly like trying to suck it up in your nose and it doesn't run down. Also, a lot of times people will get what we call postnasal drainage or postnasal drip, where you feel that drainage in the back of your throat, and that's just because of all that congestion that is draining to the back, and it can cause irritation to the back of the throat, and you will hear a lot of people go if they're always clearing their throat because of that postnasal drainage. And that postnasal drainage can also cause some irritation in the back of the throat. So a lot of people can complain of a sore throat, and sometimes it's even red back there. So remember, this can also sometimes be confused with strep, but again, with strep, usually we see enlarged lymph nodes, fevers, usually no cough, whereas the postnasal drainage can induce a cough because you're having that drainage and irritation back there. And then another thing that you can see is on exam, that is we can see fluid behind the ears, because if you didn't know, All of this is connected, our ear, nose, and throat. So that's why they have those doctors called ENTs, so ear, nose, and throat doctors, because this is all connected. So again, when your nose is so congested and it causes the postnasal drainage because it has no place else to go, that fluids also starts building up behind that eardrum. So a lot of times we see dysfunction of what we call the tympanic membrane or the eustachian tube. We say eustachian tube dysfunction. We're using some big words here. And a lot of times the back, when we look in the ear, we can see that that area is retracted, sometimes dull, and again, just that fluid back there. So everything's really wet. So if you're having these symptoms or you're used to these symptoms, you probably should talk to your doctor about potential allergies. Some other symptoms we see are watery, itchy eyes, and sneezing, and again, just irritation. A lot of times this can be very uncomfortable for people. They can feel fatigue, just not, up to their normal self. So again, it can affect people and their work and their quality of life. So if you are having these symptoms, what can you do about it? So number one, you can either see your primary care physician about this. Another option, if you prefer to know exactly what things are, let's say you go and you know that it is seasonal, it occurs when the seasons change, but you're like, no, I want to know exactly what it is. There's some tests that can be done to pinpoint what allergies you may have, and that can either be a skin test that's done, and again, it almost looks like a tray, so there's a lot of tests, and pretty much they prick your skin. We also call it a skin prick test, and normally they'll do it either on the arm or on the back, and each little prick injects a small amount of whether it's animal dander, so cat dander, dog dander, pollen, mold, things like that serum to see if there's a reaction, and then you'll sit for a certain amount of time, and again, they're looking for a reaction that's bigger than a certain size. Now, the other thing you can do is also just get a blood test. So pretty much like an allergy profile. So there's different profiles for mold. If you want to get tested for food allergies, so like seafood and things like that, you can also get blood work done. Now, a specialist who specializes in allergy is called an allergist and immunologist, because allergies have a lot to do with our immune system. Now, with that being said, if you do have allergies, there is a term called atopy that is almost like a triad, and it has to do with allergies, eczema, and asthma. So pretty much what this term atopy means is that once you have one of these diagnoses, so whether it's allergies, asthma, or eczema, you are more prone to getting one of the other diagnoses or having all three. So if you have allergies, you are more prone to also having asthma and or eczema. So that's something to keep in mind, especially when we see kids. If we notice that, let's say they have eczema, and then all of a sudden as they get older, they're kind of like, and the mom's telling you that they have a constant runny nose, and they're not having any fevers or anything like that, your suspicion would be much higher for allergies. Normally with allergies, there has to be exposure to things in order for the body to start reacting. So when kids are less than 2, we usually don't see a lot of allergies, and we try not to give the diagnosis of allergies. Of course, everybody is not textbook, but normally by the age of 2, kids have been exposed to more things. So they're going outside more, they may be around more animals, they've had the chance to go through a couple of seasons. So really it's over 2 when we truly say like, hey, we have enough exposure with somebody to say that it is allergies. So let's say you go to the doctor and you find out that you do have allergies. What are some things that you can do, and how can it be treated? So some options that your physician may bring up are antihistamines. So these are medications that can help with these symptoms. So some of these examples include Benadryl, Zyrtec, Claritin, or Loratadine, Zyzal. These are all over-the-counter medications. Now, with these examples, again, please be advised that you should contact your physician to see which one is best for you, because some important factors that play a role. For example, one thing is if somebody has high blood pressure. So for example, there is Claritin D or Allegra D, and the D stands for decongestion, and the decongestion added to that is a component that can cause somebody's blood pressure to go up higher. So normally if somebody has high blood pressure or hypertension and allergies and they're wanting to take something, we usually don't recommend any medications that have a D attached to it, because again, that decongestion component in the medication can cause the blood pressure to go up. So again, that's why it's very important that you need to see your own physician or take your child to their physician so they can specifically be assessed and get the appropriate medication for yourself or your family. Some other things that are used are nasal steroid spray, so things like Flonase can be used now. That's over the counter, and that also helps to dry up that postnasal drainage, that congestion that's in the nose. So these are all great things. Another thing is nasal saline washes, which are great because that helps with all that junk that gets stuck in there. So even though it's not very pleasant, that's where you squirt that saline up in your nose and then all that goo comes out. If you ever done that before, you know what I'm talking about. Now, what are some complications with allergies that we can see? Some complications can be sinus infections, and that is because when all that congestion and that junk is sitting there, if it's chronic, an infection can start brewing. So that's one thing. If you notice, again, I reiterated that with allergies, we normally see clear nasal discharge, but if you see that your allergies have been acting up and all of a sudden in about 2 to 3 weeks after your symptoms started, that congestion has become thick, green, or yellow, and you're having a lot of pressure. We have a few sinuses in our face that if you feel pressure in your head or your face, like your cheeks, it may have turned into a sinus infection. Usually with that, we treat sinus infections with antibiotics. So again, you and your family would need to be checked out by your physician. So these are all important things. Of course, with allergies, one big thing is if you know what your trigger is, and that is what'll set you off, definitely stay away from it. And I know it's tough if you have environmental allergies, because of course it's hard to stay away from pollen when you go outside, or grass, those things that are flying around. But really you want to go out when it's not as much. And most weather channels are really nice, and you can just Google online what the pollen level is to see if it's a good day to go out, or if it's not a good day to go out if the pollen level is high. Of course, if you have allergies to any animal dander, try to stay away from those animals if you can. Again, these are all things that if you can, and if it's possible, I know it's tricky. Some other little tricks of the trade are if you don't necessarily take an antihistamine all the time, and for example, you're going to a friend's house who you know has a dog, and let's say you're allergic to dog dander, you can always take an antihistamine before you go to help with those symptoms and decrease the chances of anything happening. And the same thing, let's say it's a day you're going out July 4th and you're going to be barbecuing outside, you can always go ahead and take an antihistamine. Most of the time, people do not have to take antihistamines every single day for an entire year. Normally, it is more seasonal, like if they have seasonal allergies, or if it's during a time where their allergies act up, or they're being exposed to a situation where their allergies would be triggered, is when they normally take it. Again, if you have any questions or you feel you do have allergies, definitely speak with your physician or your child's physician regarding symptoms that are occurring and what treatment would be best for you and the next step. Alright, so before I end today's show, again, just to give you some tips on surviving and conquering during COVID-19, one fact that's been a little disturbing is that it's been noted and seen that domestic violence and child abuse has gone up slightly with the social distancing and the isolation with COVID-19. So I just wanted to give you some tips if you're at home with your kids, if you're working at home. And I know now a lot of schools have closed for the remainder of the school year, so you're having to help them with their school curriculum and being with them all the time. Just some tips to help you to stay sane and to help everybody just remain safe. So tip number one, keep a routine. You know, kids love routine, and make that routine a great routine with a good mix. So of course, there's time for schoolwork, there's time for a break, there's time for arts and crafts, there's time for screen time, there's time for reading, there's time for relaxation, there's outside playtime. So definitely make a routine, because then the kids will get into that routine, because when they go to school it's the same routine that kids do. So that's usually a great idea. The second thing is, remember to take breaks. Breaks are great for everybody. And in those breaks, have a little me time where each person gets their own quiet time, that they can do something that they love, they enjoy, and something that causes them to relax. 3, definitely take a breath when something happens. Try not to react right away, because of course it is known that as humans, and when we act right away, we're usually a little bit more aggressive. So when something happens, try to take a deep breath. It'll give you time to think through what you want your reaction to be. Plus, it'll help you to calm down. So instead of screaming, you can say, please do not do that. That's not nice. Or mommy or daddy asked you not to do that. You'll be amazed that within that 1 or 2 seconds that you took that deep breath, how your reaction can change. And then of course, stay healthy. Make sure you're eating right, make sure you're sleeping well, make sure everyone is exercising and getting out there and moving their bodies. These are all important. So I hope those Conquer COVID facts are going to help you. We are going to make it. Definitely don't forget, if you're having any what seems to be allergy symptoms, check out what your doctor can do and talk to them about your concerns. Don't forget to wash your hands, kiss your kids, love your family, and say your prayers good night. Bye-bye, and thanks for watching.